Hello, this is Dr. Wells with Wells Medicine, and I wanted to talk about two sort of out there psychedelics today, ayahuasca and Ibogaine. Ayahuasca is not currently legal in the United States. It is a South American psychedelic traditional mixture, and there are people that travel to South America for these journeys. Ayahuasca is about a 6 to 8 hour psychedelic experience, generally very, very intense, generally a lot of vomiting and diarrhea, and that is considered part of it. So even though in America, if you're having nausea or diarrhea, we would treat that. Certainly one of the side effects of ketamine is nausea, but we treat that so that patients don't experience the nausea with the ketamine treatment. But the purge is considered a part of the ayahuasca experience. Generally, during an ayahuasca experience, patients will experience visions surrounding a female deity or lots of female deities, sometimes called the mother. Often there will be sort of a jungly theme to their overall vision and experience. Even if they're having this jungly theme using ayahuasca illegally in the States, but certainly, when patients travel to Costa Rica or other countries in Latin America where the medication is traditionally used and receive the medication from shamans, there's often this jungly theme to it. Very frequently in Latin America, these medications are provided during retreats where there will be a structured integration framework, there will be ceremonies, there will be shamans, you're there for multiple days, and there can be sometimes 1 to up to 3 to 5 journeys over the course of that multi-day treatment program. A lot of popular press seems to imply that these programs are curative, but from the data that I've seen, and again, it's hard to study because this isn't a legal medication in America, the amount of medication in each dosing of ayahuasca is very variable. The amount of the two ingredients that are blended together to make the individual mixture of ayahuasca can be different from each shaman to each retreat center. So it's very difficult to have a randomized controlled evidence-based study. But from the data that I've seen, again, not everyone benefits from these treatments. The duration of benefit is certainly not forever. Generally, it's around 6 months, 3 to 6 months, before patients are seeking ketamine treatment again or going back on their medications for depression. Most patients don't want to repeat that ayahuasca experience within 3 to 6 months. It's generally enough of a intense experience, the travel, the vomiting, the diarrhea. Often these are done in a group, so there can be, someone else having a very loud and intense internal experience themselves, which can be very disruptive to the group if it's not handled well. There can be medical emergencies. So ayahuasca, depending on how it's mixed, can cause seizures. People can have difficulties from the dehydration, from the vomiting and diarrhea. And because of the way ayahuasca works chemically in the brain, most of the retreats that I'm aware of ask patients to be off of their antidepressant medications for up to 6 weeks beforehand, which can be very dangerous as patients tend to withdraw very rapidly from these medications to be able to go on the retreats. And there can be dangers of rapid antidepressant withdrawal as well. Seizures, terribly increased suicidal ideology, and severe depression resurfacing as patients are withdrawing quickly from these medications. Ayahuasca isn't something that at this time I can recommend to patients just because I see so many side effects compared to the duration of benefit that I'm seeing. I think if it could be regulated, if it could be scaffolded a little bit differently with some accountability and some more stable protocols, it's possible that in the future this could be a great treatment benefit, but I'm just not seeing that for this moment. So the other substance I wanted to talk about is Ibogaine. Ibogaine is a natural medication from Africa, and I'm using the term medication to mean any substance that has effects in the body. The natural substance from Africa has a very potent psychedelic effect. It's one of the longest lasting psychedelic effects, with journeys or trips lasting 24 to 36 hours from a single dose of Ibogaine. And it's a very, very intense medicine experience. Often Ibogaine is used specifically for drug and alcohol abuse problems. For drug and alcohol abuse, it does seem to have very high rates of success for helping patients to withdraw from those medications and to stabilize and not go back to using those medications, the drugs and alcohol. Ibogaine currently doesn't have legal status in America, but there are places that you can travel to where it has legal status. Because of the duration of the effect and how intense it is, Ibogaine really should be done, if done at all, in a therapeutic, monitored, integrative, scaffolding session. However, at this time, I can't recommend Ibogaine, one, because it's not legal in the state of Texas, but also it is such an intense and such a dramatic process that really I would only recommend it for patients who have failed multiple other medication-assisted drug programs, therapy for drug rehab, and other less intense interventions like inpatient stays and inpatient therapy, just because Ibogaine at this time is not well enough studied, and again, it's just not legal where I currently practice.